So millions of older Americans enrolled in Medicare plans are now eligible to buy certain weight loss drugs for just $50 a month. A new federal pilot program expanded coverage of Wegovy, Zepbound, and Foundayo to people with obesity. Now, previously, the drugs cost hundreds of dollars a month, if not more. Bill Green is CEO of Green Insurance Agency and really specializes in Medicare plans. He's kind of our local expert here, and Bill's joining us here this morning. Thanks for being with us. I appreciate it.
Thank you.
So this is a huge savings. Can you give some perspective here? Because if no one has ever taken these medications, I don't think anybody realizes the cost difference.
Yeah, so if you are eligible for it through a health issue like diabetes, you'd have a big deductible and you'd pay still $75, $100 a month for it.
Yeah.
If you go and buy it just on your own, people are paying $500, $600 a month for it.
I mean, just incredible. Okay, so can you explain then how this works now that Medicare is offering this coverage?
Yes, so number one, you have to have at least a Part D at some level. So whether that's a standalone Part D with your Medicare supplement plan or Medicare Advantage plan with Part D. What's kind of unfortunate is that veterans, TRICARE, they very rarely get a Part D, so they're left out. And then veterans who only use the VA who don't have a Part D are also going to be left out. So we're kind of leaving our veterans out on this.
So that said, is there an opportunity for them to, when open enrollment, comes up, for them to maybe get access to a plan or a Part D plan, or does that not make any sense to them financially based on their coverage that they get through the VA?
Sometimes with TRICARE, it can make sense. There's almost no reason not for someone with the VA only to not get a Part D drug plan or part of the Medicare Advantage plan. And what's rather unique is that having other credible coverage like veterans or TRICARE actually allows those folks to enroll outside normal time periods. So they can even enroll now if they wanted to.
Oh, they can? Okay, but that's just it's just veterans?
Just veterans,
And
yeah.
anyone, okay, retired military, obviously. Yep. So let's talk a little bit about what the requirements that make somebody eligible then for this new plan.
So minimum 27 BMI. So from 27.
Body mass index for people at home who may not know what that is, yeah.
So body mass index from 27 to 34.9. You have to have certain health conditions, prediabetes, certain levels of blood pressure, a few other things. But if you're over 35 on the BMI scale, it can just be prescribed.
And so this is, you also can't already be receiving, these drugs, so that now you can't say, oh, wow, they're much cheaper, so let me go this way.
Unfortunately, that's right. So if you're already receiving the medication for diabetes, certain heart conditions, sleep apnea, you'll continue to go through your current plan at your current costs.
So do you know, is this pills, injections? Some of this medication you can take orally, others you have to inject?
So it's the Wegovy.
Injection or tablet?
Wegovy's injection.
Okay.
Foundayo's a tablet, and then the Zepbound is also an injection.
Would you also remind us, for our viewers who aren't even thinking about Medicare age yet, just when does someone become eligible for that and how they enroll?
So most people become eligible at age 65. There are some folks who go on earlier due to disability, but we're having more folks who work past 65 to continue that retirement account, Social Security, and those folks who are retiring can enroll year round.
And this program is kind of a pilot program. It's not going to be available forever.
It is.
I mean, unless it works and goes very well, we assume. Fingers crossed for people who want it.
Exactly. So the goal is to, by losing weight, people tend to become healthier.
Yeah.
So it started on July the 1st. It was originally slated to just run through the end of this year. It's now through the end of 2027.
So important to then have that conversation then also with your healthcare provider if you decide to then take advantage of this, because you at this point would have to go off, basically at the end of next year and have that conversation about whether or not the weight gain comes back and et cetera.
Exactly.
Bill, thank you. Great information for so many of our viewers. We appreciate you.